Good afternoon, everyone, and thank you for joining us for today's COVID-19 media event. Initially, each attendee will be muted. After the presentation, we will take one question from each member of the media. Please use the raise hand feature to ask your question. On the computer, you'll find the raise hand button at the bottom of the participants list. But if you're calling in, press *9. When it's your turn, we will unmute you and ask you to proceed. You may also type your questions into the chat function. We will not have a Spanish language portion to today's briefing. You do have our permission to record if you're able, and we will have a copy of the recording available upon request. Today, our speakers will be North Las Vegas Councilman Scott Black, who's also the chair of the Southern Nevada District Board of Health, Dr. Cortland Loaf, Chief Medical Officer here at the Health District, Dr. Cassius Lockhead, Director of Disease Surveillance and Control. And also joining us today to help with answering your questions, we have Joanne Rupiper, Chief Administrative Nurse, Kimberly Franich, Communicable Disease Manager, and Danielle Jamerson, Contact Tracing Supervisor. At this time, we will begin with Dr. Loaf. Thank you.
Hey, thank you, Corey, and good afternoon, everybody. My name is Dr. Cortland Loaf. I'm the Chief Medical Officer here at the Southern Nevada Health District. And again, thank you for joining us today. As you are all aware, our community has been experiencing an increase in COVID-19 cases and a corresponding increased demand for testing. In response, we have worked with our partners, including the Clark County and the state of Nevada, to expand our testing resources here in Southern Nevada. Working with Clark County and our partners at the federal, state, and local levels, we opened up 2 large-scale testing sites at Texas Station and a second one at Fiesta Henderson last week. While there has been an emphasis on testing, it is important and it is an important measure for identifying the virus, so as we can take steps to slow the spread of illness in our community. I want to remind everyone of the importance of getting fully vaccinated and boosted if you can to protect yourself and others. Fortunately, we have plenty of vaccine supply available, and community clinic sites are conveniently located throughout Clark County. As of January 18th, there have been a total of 3,282,631 doses of vaccine administered in the county. More than 84% of adults have initiated vaccination, and 73% of people ages 5 and up in Clark County have initiated vaccination. Additionally, 68.85% of adults have completed vaccination, and 58.74% of people 5 and up have completed their vaccination series. We are also reporting 439,668 cases of COVID-19 in Clark County today, an increase of 2,956 since yesterday. We are also reporting 6,675 deaths, an increase in 29 from yesterday. Recently, the Health District received a supply of an antiviral medication named Paxlovid. This is an antiviral medication that can be used to treat people early in the course of their COVID-19 infection. Unfortunately, the supply at this time is very limited, and we are only able to offer it to those people who test positive for COVID-19 at our Health District clinic, who are symptomatic, are over the age of 65, and meet some additional criteria for taking the treatment. These criteria may be expanded as we get additional antiviral medications. The treatment is free, and we are pleased to provide expanded access to our public health location. We are also encouraging everyone to continue to wear masks in public indoor settings, as well as crowded outdoor settings, and when around people who may not be vaccinated. The CDC has updated its mask guidance and is recommending that people wear the most protective masks they can. All masks provide some level of protection when worn correctly and consistently, and they should fit you well, and you should be able to wear your mask consistently. N95 and KN95 masks or respirators do provide more protection against COVID-19 than other forms of masks. In the past, it was recommended that these types of masks could be prioritized for healthcare workers. Now, they are more widely available and recommended for everyone. However, some people may find these respirators uncomfortable and may take them off more frequently. People who continue to wear cloth masks or surgical masks are recommended to double up, meaning wear a surgical mask with a cloth mask over it for better fit and protection. Now, if you choose a respirator, look at how it fits and read the manufacturer instructions. The CDC has additional information for checking the authenticity of these masks and on their updated guidance. I will now turn it over to Councilman Scott Black, Chair of the Southern Nevada Board of Health. Thank you.
Thank you, Dr. Loaf. And once again, thank you all for joining us this afternoon. It doesn't go without saying that we really appreciate the media for your continued support and your efforts to help us keep our public informed. It's an ever-changing landscape, and we rely heavily upon you and are very grateful for your support to get the word out of the most recent information for our public. As Dr. Loaf mentioned, we're working diligently as a health district with our regional partners to ensure that we have enough testing resources available throughout our community. As a health district board member and North Las Vegas City Councilman, I know how vital it was to get additional large-scale sites for testing up and running, including the one that we put in effect at Texas Station to help serve our community. I also want to encourage people who need to get tested to use the resources that are available. There are more site locations, more expanded hours, and while the self-testing home kits have been in short supply, they are available in our community at some clinic locations if you don't want to wait for a test. And also, you can order them free online now at www.covidtest.gov. I also would like to reiterate what Dr. Loaf said, how important it is to stay up to date on our COVID-19 vaccinations. Getting vaccinated, if you haven't already done so, is critically important. Also, the COVID-19 vaccines are available for ages 5 and up. Boosters are available for ages 12 and up. If it's been 5 months since you've completed your initial COVID vaccine series. And I just want to also reiterate that the COVID-19 vaccines are effective for protecting people from getting seriously ill, keeping people out of the hospital, and ultimately preventing people from dying, which is critically important. I'd like to encourage everyone to continue to follow all the recommendations by our public health and medical leaders to keep ourselves, our loved ones, our families, and our community safe. And with that, I would like to now turn the time over to Dr. Cassius Lockett.
Okay, well, thank you, Chair Scott Black. I'm Dr. Cassius Lockett, Director of the Division of Disease Surveillance and Control with the Southern Nevada Health District. I also want to reiterate and thank all of you for being here today, especially to give an opportunity to get critical information timely to the community. As mentioned, we are continuing to see increases in COVID-19 case counts, as well as increases in testing demand. We know these increases can be primarily attributed to the Omicron variant. While we are still identifying the Delta variant in our community, the Omicron variant is the primary strand identified in the samples that are sequenced, and that's at the tune of over 90%. As of January the 15th, our 7-day average case count was 3,135. This puts us well within the high transmission category. To move to the substantial transmission category, we will need our 7-day average case count to fall below 330 cases, and that's summed over a 7-day period. What that does is it gives us a case rate less than 99 cases per 100,000. And to move to the moderate transmission category, our 7-day average case count will need to fall below 165 cases, summed over a 7-day period, which gives us a case count or a case rate of 49 cases per 100,000 population. Moving to testing, our single-day test positivity rate is starting to marginally decline. I'll admit that. Today, the rate is 38.3%, down from 43% reported on January the 9th. Meanwhile, the 7-day average test positivity rate, not the single day, the 7-day, reported on January the 14th was 41.2%. Over several days, we have seen the 7-day test positivity rate experience a marginal decline as well as a single day. While this is encouraging, I just want to make a point for everyone to keep in mind that 2 days don't make a trend. So, and we also have to remind ourselves that we are still near the top of the epidemiological curve, and it is too early to say if we are seeing the end of the surge. It is important to note that the health district's test positivity rate is calculated using only PCR tests, or these molecular tests in the numerator and denominator. The information on the Nevada Health Response website reports a 14-day positivity rate and includes both provider-reported antigen from point-of-care test and PCR test. We have also seen a decrease in influenza-like activity in our community recently. A couple of weeks ago, activity was high, and now it's dropped to minimal during the last reporting period, which is great news. However, we still recommend people get a flu vaccine if they haven't already, as flu activity can continue all the way through the spring. So COVID testing remains central to our overall mitigation strategy, and we encourage people to continue to get tested and to take necessary steps to protect themselves. The opening of larger scale testing sites at Texas Station and Fiesta Henderson, in collaboration with Clark County and other federal, state, and local partners, has added significant capacity to our community that we're proud of. As of Monday, more than 12,000 tests have been administered at these sites, more than 5,000 at Fiesta Henderson, and more than 6,900 at Texas Station. And we have extended our hours to test at several sites at our Enterprise Library, Windmill Library, Sahara West Library locations. These sites are now open Monday through Thursday from 10 to 7:30 p.m. and Friday and Saturday from 10 a.m. to 6 p.m. At this time, we can provide a minimum of 30,000 tests per week at our health district and partner locations, and people can go to our website for our testing locations. Additionally, locations are also available on the Nevada Health Response website to find the testing location. The health district receives self-test kits that are being distributed, as well as additional allotment of tests from the Nevada Department of Health and Human Services. We have developed a plan to distribute these test kits to our community partners so they can assist their clients to access testing. These include partners who provide services to family and children, older adults, people accessing state and federal assistance programs like WIC, and faith-based communities. The availability of self-tests is a tremendous resource for our community and is helping to alleviate the demand at our community testing sites. However, it is important for people to keep in mind that self-testing results do not get reported to the health district. People who test positive should self-isolate and inform their close contacts about their infection so that they can get tested. We will continue to evaluate testing capabilities and make adjustments. Some sites are busier than others, as expected, and we ask for patience from the public as a result. By registering for testing, the process will run more smoothly, and that is our hope, to reduce sometimes walkouts. Regardless, thank you very much. I will now turn it back over to Corey for questions.
Thank you, sir. At this time, we will open it up to questions from members of the media. Each person gets to ask one question. Please use the raise hand feature to do so. If you're calling in, be sure to hit *9 in order to raise your hand. And if you want to ask your question in the chat box, feel free to do so. When I call on you, please identify yourself and the media outlet you represent. We will begin our questioning today from Stephanie Garibay. I'm unmuting you now.
Hi, my name is Stephanie. I am with KTNV. I was just wondering, with the at-home COVID-19 testing kits, are people required to report their results to the health district?
Yeah, this is Cassius Lockett. I just, in this opening statement, try to clearly articulate that at-home test kits are not reportable to the health district. Currently, we accept PCR test results in healthcare. Those point-of-care tests do make their way into our system, but they're not really used for our calculations like our test positivity rate.
Next question today is from Jeff Gillen.
Yes, good afternoon, everybody. To anybody on the panel who would like to weigh in, Dr. Loaf or whomever, a perspective just on the hospitalizations. Are you concerned about hospital capacity at this point to to treat the Omicron variant and COVID-19 that you're seeing? Do you think hospitals here, how much difficulty are local hospitals in right now, do you think?
Yeah, I guess I'll start on responding to that. Maybe I can ask Dr. Lockett to step in as well. So we are aware that the hospitals are being strained by the current surge of COVID, in part because of staffing resources, or lack of staffing, I should say. I think any specific questions related to hospital capacity would definitely directly to individual hospitals or to the state hospital association, but perhaps Dr. Lockett can weigh in with some additional information.
Yeah, so this is, Cassius Lockett again. I'll just piggyback up for what Dr. Loaf mentioned here, and that is the challenge right now. It's a sort of perfect storm of inadequate staffing levels, and then surges in patients and percentages of COVID patients showing up in the ICU compared to Delta last year. If you want to get those exact numbers, I would encourage you to reach out to the Nevada Hospital Association. They're also trying to work on trying to offset some of the clients by offering outpatient monoclonal antibody therapy. That's a program we're trying to work on partnership with Clark County on, and we'll see. We're making some progress on that, but as you are aware, some of those monoclonal therapies are in short supply, causing us to delay that type of operation.
Please remember to identify your media outlet. Next up, we have Lauren Clark.
Hi there, everyone. Lauren Clark here with KSNV Channel 3. Reaching out, and thank you guys all for doing this. You know, we've established that these at-home test kits are not included in the data that we're looking at. But how are they factored in, just to consider how much Omicron is spreading within our community? You know, we have the PCR test, but they're perhaps only giving us a fraction or just a little bit of a glimpse of what Omicron actually is doing in Clark County. Is there a range that you're looking at just how many more cases could possibly be the true scenario here in Clark County, or how is that kind of factored in?
Yeah, this is Cassius Lockett again. So you're correct. Regardless of whether it's a PCR test or whether it is a home test kit, the difference is that the Omicron variant doubles every 2 to 3 days, unlike the Delta variant, which doubled every 2 to 3 weeks, right? So it got ahead of us real quick and infected a lot of people very quickly. And what that did is created a testing surge demand in our environment that we just couldn't keep up with. That coupled with the fact that 30% of the population is still asymptomatic, and those infections still spread in the community. And so our data, it represents definitely what's happening and how the disease is transmitting across communities, but it is definitely an underestimate. And one of the reasons being is that Omicron is, and this, let me make this clear, it's just as infectious as measles, meaning that one person can infect up to 15 people quickly, right? And the way it's spread is a little different. It's usually, viral particles are spread through droplets, respiratory droplets that go about 3 feet, and then they fall on the ground quickly, and that's not an example of like extreme transmission. Extreme transmission, the way Omicron behaves, is it's spread through little tiny nuclei droplets. So imagine a dandelion flower, and you blow on it, and those dandelion seeds fly in the air and they kind of float along, right? And so when they float in suspended animation and they remain in the room, you could actually follow up and go in that room 1 hour, 2 hours later and get infected. It is highly infectious. So we definitely are not saying that we have accounted for every single case. And so the best conditions, under the best conditions, if you have some of those symptoms, a runny nose, a cough, head congestion, feeling really fatigued, most likely you probably have Omicron. And if you can't get tested, your best option is to stay home and quarantine for 5 days and then follow up with wearing a well-fitted mask once you go back out into society. Hopefully that helps.
Thank you. Our next question today is from Emmanuel Velasquez.
Yeah, good afternoon. Emmanuel Velasquez here from NBC and Telemundo. My question is following up some of the questions of my colleagues. Why the health district is not going to require the people to report the home test? My question is because we have a high demand of COVID testing in all over the state, and the people don't want to wait online, so they're going to request the test that both the state, the test that both the president, and if we don't have the numbers, maybe we don't have an accurate statistic about how it's going, the COVID-19 in the state. So are you considering to have any web platform, website, so the people can report the results, and actually the district, the whole district can, following up with that people with symptoms, any other, like, I had a COVID test in the whole district, and that when I test positive, the health district called me and sent me some text. So do you consider to have any web platform or website so that people can report the results?
Yeah, no, that's great. That's a great question. We understand that concern. I'll just say that this is an overall structural problem in the United States. And that's why the Centers for Disease Control and Prevention has rolled out the Data Modernization Initiative so that we can strengthen the public health surveillance system across the country. We're not like other countries where they're more sophisticated, and some of the countries like the UK, where some of those at-home test kits are reported a lot easier, and they use automation and a little bit of magic, call it auto magic, to make that happen. Our systems are still kind of antiquated, and they're not linked across all states. And so CDC is pumping in a lot of money to strengthen that surveillance system. However, with that said, I do believe on our website, we have made it optional for the community, if they want to report in their results, to sign up, register, and then test and report that test result out to us. If I'm wrong about that, I'll ask Kimberly to step in and clarify that part of your question.
This is Kimberly. That's correct. Through our online morbidity reporting system, there is an option to self-report.
And to find that, you can either do a search for it on the main health district website, or if you go onto our COVID website, go to the testing page, then click the button to learn more about self-testing, and that link is on that page. Our next question today comes from Mary Hines.
Thank you and good afternoon. Are you aware of any reinforcements that might be made available to area hospitals to assist them with their staffing crises?
Hey, Mary, this is Dr. Lowe. I can take that question. So we're not aware of any requests at this time for additional resources, but again, I would direct those questions specifically to the hospitals or to the Nevada Hospital Association.
Thanks.
Next up today is Jonah Dillon.
Thanks. This is Jonah from the RJ. Wanted to follow up on what Dr. Lockett was saying earlier. It's been 2 days of numbers sort of decreasing. When you look at the overall picture, how much time do you want to see the numbers, test positivity rate going down before we can say with more confidence that we've reached the peak of the surge?
Yeah, so thank you, Jonah, for that question. I think, it would be ideal to see those numbers, especially with the test positivity rate, go down, I would say, for at least consistently for a week. I would start to feel a lot better. That coupled with wastewater SARS-CoV-2 concentrations, I think with that going declining at the same time would feel a lot better, especially I think wastewater SARS-CoV-2 data concentration in wastewater is underutilized. And I think that's something we have to start paying closer attention to. Usually what happens is that obviously test positivity rate goes down, subsequently cases go down, subsequently hospitalizations go down, and subsequently you see fewer deaths, right? But wastewater concentration, also, we want to see that go down consistently across all of the testing sites every single week for at least 2 to 3 weeks. We want to see those concentrations decline, because usually what happens is that after you see those concentrations go down, around 10 days later, you start to see our local cases go down. So when I see test positivity rate goes down consistently for a week, coupled with wastewater concentrations going down simultaneously, then I would feel a lot better and say that we are probably now on the downslope of this huge epicurve.
Our next question today is from Jacqueline Schultz.
Good afternoon, everyone. As the latest data from today shows, a lot of people are learning that they are a breakthrough case. It's 41% is the most recent figures. What can you say to those who are vaccinated, who are getting a breakthrough case, and just breakthrough cases in general? Why they're less severe, why this is extremely important, and a message to those who are not vaccinated who say this is mild, I'm going to get it anyway. It's fine, because we are seeing the vast majority of people in hospitals unvaccinated.
Yeah, I'll let Dr. Loaf chime in on the vaccination part, but I will just say that, you know, the vaccine in general, when they're made vaccines, they're not intended to stop infection. They're intended to prevent you from getting severely ill, its job. And in fact, most of vaccinated people are experiencing actually flu-like symptoms. The symptoms are very mild: body aches, nose, runny nose, sore throat, stuffy nose. And so that's because they have been vaccinated. Otherwise, they would be experiencing more severe symptoms. But I'll let Dr. Loaf chime in there.
Yeah, I don't really have much to add to that, except reiterate a couple points. One is our data suggests that by getting fully vaccinated and boosted, it significantly reduces your likelihood of being hospitalized or dying as a result of COVID infection. So that's number one. That's the most important thing. And with that, we continue to remind people to get vaccinated if they've not been vaccinated yet. And if they're not fully vaccinated, if they haven't yet received their booster and they're eligible to receive one, to get their booster. I think I answered all points of your question. Is that correct? Or do you have any further follow-up on that?
Yes, thank you. Also, I didn't know if you had any data on the breakthroughs among boosters. We are seeing some people get breakthroughs with boosters as well. Just to kind of emphasize the points of why it's all still important.
Yeah, that it's not surprising to hear that. We do know that folks who are fully vaccinated and boosted, we will continue to see breakthrough infections among that population of people. That's not to say that the vaccine is not effective. The vaccine is very effective, again, because it not only can help prevent infection, but more importantly, it can help prevent very severe disease, hospitalization, and death. So that's why we continue to want to remind people about the importance of getting vaccinated.
Our next question today comes from Janelle.
Hello, I'm Janelle Calderon with the Nevada Independent. So is this the first time that Clark County hospitals have asked the governor for staffing help from the governor's office? What has been his response? What conditions have triggered this request?
Yeah, again, Janelle, I would direct those questions directly to the hospital or to the Nevada Hospital Association. I think they're in the best position to answer those kinds of questions.
Okay, we're going to go through just a couple of quick follow-up questions and wrap it up for today. Stephanie?
Sorry about that. I was just wondering, a quick follow-up to the first question I had about the at-home COVID-19 test and reporting that. Are you guys concerned at all about the cases being underreported? And what exactly, if they are being underreported, what exactly does that mean for the general public?
Just so you know, throughout the pandemic, cases have always been underreported. If you remember at the beginning of the pandemic in 2020, back in March, testing was extremely limited. And then everybody decided, oh, we got to do more testing. And then we only had the molecular test available. Now we have the antigen test kits available to help us get people to use the public health tools to stop spreading the disease. And that is, you don't necessarily have to report to us. We're not concerned about that. We're only concerned that if you test positive, especially with an antigen test kit, if you test positive, you really probably are infectious. The way those tests are designed by looking at the amount of protein in your blood. And so you really are infectious when you get positive test results there. And we just really want to make sure that you take an opportunity to isolate and follow CDC guidelines for 5 days. And if symptoms resolve and you're fever free, guess what? Wear a well-fitting mask, go back out into society. That's what we're really concerned about.
Okay, we'll do a quick follow-up from Mary and then one from Jacqueline, and then we'll be done for today. Mary, your next question, please.
Great, thank you. I believe you said that your maximum testing capacity is 30,000 tests per week. I'm wondering then what level you're at currently per week.
Yeah, hi, Mary. Thanks for the question. Yeah, so just real quick, that I said minimum of 30,000. So without all of our testing capacity, we have about 5 kiosks. That's a part of that. We have, as you already know, the 3 major testing facilities now with Sam Boyd, Fiesta Henderson, and Texas Station. And we have 15 mobile testing sites and about 5 fixed testing sites, just to give you a flavor. But not even with all of those, we hit 30,000 tests last week. But we can go, and that did not include, by the way, Texas Station. It did not include Sam Boyd, and it did not include Fiesta Henderson, which I indicated last week did 12,000 combined alone, just with the 2 new sites. And so we're probably honestly closer to 40,000, slightly over 40,000 testing capacity a week now with those additions. That's why we said minimum.
And our last question today is from Jacqueline.
Hi again. What can you tell us about how the health district has been working with schools during the surge in cases among teachers and students? And is there any recommendations you've given to them so far to curb the surge?
Yeah, very timely question. And I know Kimberly met with the school district this morning to talk about issues. And so I'll turn it over to her to answer the last question.
Hello, thank you for the question. This is Kimberly. Yes, we work very closely with the schools and as of most recently, work to support their efforts in meeting the needs of their students and staff. We provided recommendations on how contact tracing can be prioritized and looking for the groups that are most vulnerable to severe illness. In addition, just providing support to them with our own contact tracing teams to be able to contact those that have tested positive, regardless of where or when they tested, to provide the isolation guidance to reduce the spread of transmission with schools. So we do work really, really closely with their teams on a regular basis to support their needs and answer any questions they may have, and then provide actual staff to assist their staff internally.
Thank you, Kimberly. Does anybody on our panel have anything else they'd like to add for today? All right. Thank you all for joining us for today's briefing. We just wanted to remind you that the Health District and our community partners are operating 30 COVID-19 testing locations throughout Clark County at this time, several of which have recently expanded their hours and days of operation. You can find a list of those sites on our website at snhd.info/COVID-testing. Plus, we're also operating 15 or more public vaccination clinics in Clark County at this time. You can find those on our site at snhd.info/COVID-vaccine. Thank you again, and we will see you all next time.